Let's bring in Republican Congressman Michael Burgess of Texas.
Michael, how you doing?
Never been better, sir. How are you?
You spent nearly 3 decades practicing medicine, so I'm curious, did you have a chance to read the bill?
Oh, yeah. The bill was actually read, the base bill was read in committee a month ago when it was marked up in that 28-hour markup. The amendments, of course, have been, 2 of the 3 have been available for several weeks, and the last amendment that was available last night was 2 pages. So, yes, those, I have read all of those.
And what do you think?
How are you feeling about that?
How are you feeling?
Well, look, I am a member of the authorizing committee that went through the 28-hour markup a few weeks ago, and I thought we had a good product that the committee produced. Remember, too, that this bill actually was passed in December of 2015 as a reconciliation bill, passed the House and the Senate, was vetoed by President Obama, and that, of course, was the base bill after the November 8th election. That was the base that we began working on in December of this year. I would just point out, too, I mean, you've had an election in 2010,
right,
one in 2014, one in 2016, where Obamacare was on the ballot, right, and the people spoke, and they wanted something done. So today is the first, or the next step in what is likely to be a very long process. I, like you, am anxious to see the fine minds over in the Senate get to work on this. They have leveled a lot of criticism at their House counterparts over the several months while we've been working on this. All right, fair enough. After 1 o'clock this afternoon, it will be on their docket.
All right, but Congressman, you said there have been elections. There have been elections to replace Obamacare. You also had an election of a president who promised that premiums were going to be lower, that more people were going to be covered, and promised a lot of things that I think you'll agree with me this bill doesn't deliver on. So,
well, the bill is a step in the process. I would also point out, and although I supported Governor Romney in the 2012 election, I think it was his failure to involve health care in the presidential debate that likely led to his lack of success in 2012. But look, there are plenty of arguments on all sides of this. I will say that I liked the bill as we brought it out of committee a month ago, but good members have offered good suggestions. Those have been listened to by the House leadership, and certainly yesterday the White House got involved with the Upton-Long amendment. I think those were good changes, reasonable changes. We went and met in the Rules Committee last night, had about a 2-hour meeting, and now we'll have the debate on the floor this afternoon. I think that's all as the founders intended. Now, it does have another step to go, and that's over in the Senate. And just like you, I'm anxious to see the great work that they will do on our product. But we're the key that gets through the door on something being done. And Joe, I agree with you. A market-based system in healthcare, I think, is important. There do need to be market signals to which people can respond. I think when you look really at the substance of the bill, remember too that a governor would have to ask for a waiver for those figures that you were talking about earlier. A governor would have to ask for a waiver out of the essential health benefits and the community rating aspects of our base bill. Now, are any governors going to do that? I have not heard from any who will, but they have the option, and some members felt very strongly that there did need to be more flexibility for the governors. They will now have that. If there is someone who has that waiver given in a state where they have, in the individual market, not in the employer market, not in Medicare or Medicaid, but in the individual market, a very narrow segment of people could be exposed to those premiums, as you showed. That's what the $8 billion is there to help.
All right, Congressman, thank you so much for being with us. Congressman Michael Burgess from Texas.